Partogram first consists of the personal details of the patient such as name of the patient, OPS score of the patient, hospital number, date of admission of the patient, time of admission of the patient, and hours since rupture of the membrane. Then comes the FHS. FHS plotting, it is either measured through auscultation or through Doppler. Normal FHS range is 110 to 160 ppm. In first stage of the labor, we measure the FHS every 30 minutely. And in second stage of the labor, we have to measure FHS every 15 minutes once. And if it falls between the range of 110 to 160 means it is normal. Then comes the marking of the amniotic fluid. If the membranes is intact, we'll mark it as I. If the membranes is ruptured and it is clear, we'll mark it as C. And if it is membranes is meconium stained, we'll mark it as M. And if the membranes are blood stained, we'll mark it as B. Then comes the marking of the molding of the head. If molding is nothing but the relationship of the skull bones with each other. If skull bones or the parietal bones are just touching each other, we'll mark it as grade 1 molding. If parietal bones overlap and it is reducible, then it is grade 2 molding. If the parietal bones overlap and it is irreducible, then it is grade 3 molding, which we mark it here. Then comes the plotting of the cervical dilatation. We'll start the plotting of the cervical dilatation when the patient is at the 4 cm dilatation. When if the patient is 6 cm dilated, when we see the patient, we'll mark it in on the alert line. Dilatation of the patient is first marked over the alert line only. If the cervical dilatation graph is coming in the zone 1, then it is normal. If it is coming in zone 2, we have to be careful about how it goes. And if it crosses the action line means we have to take some action, such as either augmentation of the labor or we have to take the patient for the section by assessing the condition of the patient. There is 4 hours gap between the alert line and the action line. Then comes the plotting of the descent of the head. Descent of the head is measured by how many parts of the head is palpable per abdomen. If it is 3/5 palpable, we'll mark it as 3. 2/5 palpable, we'll mark it as 2. And no head is palpable, we'll mark it as 0. Then comes the hours since active labor of the patient. Then comes the time since active labor of the patient. Then comes the contraction. Here the number indicates the number of contractions and the marking indicates the intensity of the contractions. We'll mark it as dots if it is less than 20 seconds. We'll mark it as lines if it is 20 to 40 seconds of contractions. We'll mark it as block if it is more than 40 seconds of contractions. This means 2 contractions lasting for 20 seconds. This means 3 contractions lasting for more than 40 seconds. Then we'll write the units of the oxytocin we have used to augment either 5 units or 10 units. Then the drops of oxytocin we have used to augment. Then any drugs or IV fluids given, will mark it here. Then the pulse of the patient is checked every 30 minutes once. Then the BP of the patient is checked every 1 hourly. Pulse is marked as a dot and BP is marked as a arrow. Upward arrow indicates the systolic blood pressure, downward arrow indicates the diastolic blood pressure, and temperature of the patient is measured every second hourly. Details of the urine of the patient such as protein, acetone and volume, it is marked in this side of the partogram.